Hi everyone, my name is Kris. I'm a fitness and sports instructor here at CFP Kingston, and today I'm going to take you through how to prepare for your force test and a few different options in terms of what you can do. Before we start, I want to make sure you subscribe below so you get updates on all of our different types of content from all the different bases. So what I want to start with is actually going through each component and giving you a few exercises and reasons why they're actually very beneficial to preparing for the force test and why they're kind of similar in some of the movements that we would typically see. Our first one is going to be the 20-meter rushes. This is typically the hardest one for people who struggle with the force test pass. It's got the highest failure rate. So this one is actually a pretty big focus. And what most people struggle with is the getting up and down off the ground. Okay, so this is where something like a burpee is actually pretty beneficial for practicing that movement. And we're actually going to specify that one a little bit more to the 20-meter rushes, and that's with the hand release at the bottom, which is that minimum standard we need to meet at each drop for you to proceed to the next one. So when we talk about a traditional burpee, typically pushing back, sometimes it'll have a push-up. This one, what we want to do is we want to come all the way down to the ground, show that hand release position, jump back up. Okay. So how we will train these is in that exact same way. So instead of us just touching a line, all we're simply going to do is drop to the ground, hands up, jump to the top. Okay. And the other one is typically the control or the descent of the fall is the hardest and can sometimes actually cause harm. So we want to be able to come down to here and not slap the ground with our body. We actually want to control it. So with that, we're going to practice some push-ups. So when we come down to this position, it's kind of a controlled push-up to the floor, show the hands. So we will practice hand release push-ups. So from here, it's all the way to the floor, hands up, pushing back up. So that's our first component, the 20-meter rushes. At the very end, we're going to talk about how we put it into an exercise program, both with equipment and without equipment, and some other stuff as well. So with the sandbag lifts, I want to talk about the squatting pattern a little bit. So we can either use body weight, but ideally we would want to have some sort of load to mimic the sandbag in this position. So for our sandbag lift, we come down into a nice squat position, nice neutral spine. We grab our sandbag, touch it to the wall. So you can see the sandbag is in front of me. So we want to mimic that front load as we practice the squatting pattern of it. So we have our body weight squat. Try to get nice and deep. Or using a kettlebell or a dumbbell, we can use a goblet squat. So this is what we would train if you have some equipment at home. Okay. Show you the kettlebell as well. A little bit of a different grip. These exercises are actually going to be very similar to the sandbag drag, where it's a lot about lower body strength and power. However, I'm going to give you guys a little bit more specific with the drag, especially because it's more of a running pattern instead of a squatting pattern. So with the intermittent loaded shuttles, which is next, this is also very different from the other ones in terms of it's much more aerobically based. So what I had prescribed is actually a walk run, which we'll talk about a little bit later, but it's kind of giving us intervals of walking and running and being able to practice our technique with the intermittent loaded shuttles. With the walk run, we also have loaded shuttles, which is actually really important because we have 3 different ways of carrying it, and we'll talk about all 3 ways of how we do that. So I'll show you the sandbag first. So our first carry is suitcase at the side. That can be either left or right. We have cradle in front. Okay. And we have shoulder carry on top. Once again, left or right is optional for each person. So what we can do is we can take something like a kettlebell and mimic all 3 of those carries depending on which one you're going to use. So once again, grabbing a kettlebell into a suitcase carry. We can grab it into that goblet carry and walk, or we can come into a front rack carry as shown. Okay, so you can see the bell is kind of sitting on the wrist. We keep the elbows high and we would walk. I would recommend, if you're doing the suitcase or the front rack carry, that you alternate sides each time. Whether it be each set you do, or doing half and then alternating to the other side. Those are really important, and figuring out which way is going to be best for you is also important as well. Would I recommend everyone, if they could, bring it to the shoulder? I feel it's going to be a little bit easier for most people. Not everyone necessarily has that strength to do that, so finding out maybe what other alternatives there might be would be beneficial. With the sandbag drag, which is our last component we haven't talked about yet, very similar, as I said, to the sandbag lifts, where we're talking a lot about the squatting pattern. However, we're going to get a little bit more specific because it is more of a pulling pattern, and instead of feet side to side, it's that walking back pattern. So doing some single leg stuff. So if we're doing body weight, maybe just doing some split squats. And if we have some equipment, doing some posterior chain work, such as Romanian deadlifts, where we would bring a kettlebell or kettlebells if you had 2, 1 for each hand, basically either just inside the toes if you had 2, or like mine currently, just inside. So our first movement is pushing the hips back, dropping the torso down, reaching for the kettlebell. Now we're going to come back up in that exact same way, keeping a nice neutral spine, nice, slow and controlled, touching the ground up and down. This is great for glutes, hamstrings. It really helps support the squatting pattern. So that is more of a hinging pattern compared to a squat. With the split squats, while it's not a complete hinging pattern, it still has a lot of the benefits, especially through the hips. So a lot of the glutes and stuff get a lot of great work with stabilizing through a split squat. Okay, we're making sure our knees are being pushed in, and we come. I'll show you the other side as well. We're coming straight up and down. We're not going back and forth. So, how do we prescribe these? What I would recommend, I'm going to give you basically roughly half an hour, 40 minutes of training, and it's going to be placed into 2 different blocks. We're going to have basically an EMOM circuit, where you're going to have roughly 50 minutes to do 3 exercises. I have 3 that are just specifically body weight, and then I have 3 that you can actually use some equipment with. So, with the body weight, or what I'm calling 1A, or your first option, is going to be 5 hand release burpees, 10 hand release push-ups, and 15 body weight squats. And you can substitute those body weight squats or alternate them however you want to do with 8 split squats. So, basically what will happen is every minute, on the minute, so at the start of the first minute, you're going to do 5 hand release burpees. As soon as you're done those 5 hand release burpees, you're going to rest the remaining minute, until the start of the second minute starts, which then you'll do 10 hand release push-ups. Once you've done those 10 hand release push-ups, you will then rest until the top of the third minute, where you will do 15 bodyweight squats or 8 bodyweight split squats. Once you've done those, resting the remainder of the minute until the top of the fourth set, where we once again start with burpees. We're gonna kind of cycle through that 5 times, okay? Now, if you've got some equipment at home, a kettlebell, a dumbbell, some sort of load, we can actually change that a little bit into 10, the first one being 10 goblet squats. So we're talking about that in front. Or 10 Romanian deadlifts, okay, where we're talking about our hinge pattern. And 50 meter loaded carries, or if you have a decent enough space where you can do roughly 20 to 30 seconds of a loaded carry. That's kind of what we're looking for. If you can, a great way to do that is if you can get outside, set up some cones of about half the amount of meters you can do. So say we do 50, 25 meter distance going one way, and then switch hands if you're doing either suitcase or shoulder carry, and then switch, and then come back the opposite way. Then what we would have you do is take roughly a 2 to 3 minute rest, catch your breath, grab some water, and then we would have you do our walk run prescription. And all I would have you do is for 10 minutes, I would have you alternating for 30 seconds of a fast walk and 30 seconds of a run. That can be done outside, that can be done in your backyard, wherever you can feel it, but have a timer with you so you can do 30 seconds of each. This is for practicing, once again, our intermittent loaded shuttles and getting comfortable with alternating those two patterns. And while, yes, the run is a little bit more intense, we still want to practice our speed, okay, with the walk, because that's actually just as important with getting a better time with the intermittent loaded shuttles. And while the ILS, the intermittent loaded shuttles, doesn't take 10 minutes, getting comfortable with that will make that test a whole lot easier. And if you feel comfortable at any point, say you're just doing it back and forth, and you have a dumbbell or kettlebell at home, you can actually do a loaded carry with your walk, depending on your situation and the kind of space you have. So let's go through one set of each, see what it looks like, okay? And then you can try it at home. So body weight. So we're gonna wait for our minute to start. So we're gonna start in 3, 2, 1, go. And release burpees. Then you rest. You wait for the remaining minute to go by. Now, with the push-ups that are upcoming, if you can't do a traditional push-up, which would be all the way down here, feel free to start at the knees, show the hand release, okay, and do that for 10 instead. Okay, as we get close to our minute coming down, you're going to do your push-ups, hand release at the bottom, 10. I'll show you 5 knee as well. And rest your remaining minute. Then our last one is our bodyweight squat, where we want to try and at least have our upper thigh come to parallel. I'll show you one quick, roughly about that. However, if you can go deeper, go for it, but make sure it's nice and controlled and you have a nice neutral spine still. So as our next minute comes up, we're going to do our squats. Now, if you're doing split squats, So I'll show you a few of those. And rest the remaining minute. So once again, either 15 bodyweight squats or 8 split squats per leg. Either or is fine. Now, if we're going to use equipment, make sure you have it lined out beforehand. So I'm going to use this kettlebell, for instance, for this. And we're going to do all 3 with that kettlebell. So that's 10 goblet squats, 10 Romanian deadlifts, and a 50-meter loaded carry, which I'll just mimic. So, goblet. You're going to bring it into this position at chest level, keeping the elbows in tight, and 10 goblet squats. Once you're done those 10, rest the remaining minute. Then we're going to do 10 Romanian deadlifts. So remember, kettlebell between the toes, hinging at the hips, pushing them back, reaching for the kettlebell. From here, standing tall, doing 10. Once you're done those 10, relax. Now with the loaded carries, that's where you would have your cone set up, just to know where that 50 meters or however much distance you have is, that you can alternate back and forth. So I'm going to show you the shoulder carry, because like I said, if you can bring it to that shoulder, it's going to be the best case scenario. So getting you comfortable in that position, I think, is ideal. So you're actually going to grab it with both hands, going to bring it to your right shoulder. Okay, you can hold this, or ideally just like this, and walking normally. So you would walk with your right for the 20 to 25 meters. You would set it down, switch hands, and walk back. Once again, as soon as you're done that, rest your 30, and then you would once again start back with the goblet squats. Okay, so once again, those go 5 times through. Now after you've done the 15-minute EMOM of either the body weight or the equipment, you take your 2 to 3 minutes of rest. Once that 2 to 3 minutes of rest is done, we're gonna do our walk run prescription. 10 minutes of 30 seconds fast walk and a 30-second run. And I want to talk about each of those just a little bit. With the intermittent loaded shuttles, your walk has to be 1 foot in contact with the ground at all times. As soon as we see that skip, we would ask you to stop all forward momentum or continuing your walk. So I want you to get a fast walk, but we don't want to jog. So what a lot of people tend to do is either really quick steps or elongating their steps to help speed the process. You can do either of those, however you want to do them during the test that you think will help you be faster. Now, with the run, that can be up to you. Ideally, it's a decent run. It doesn't have to be a sprint, but if you're trying for a gold platinum time, maybe that is a sprint now. So I would start out with a basic 70 to 80% run and try to increase your tempo each time. So at the end of those 10 minutes, your last 2 or 3 sets are pretty fast. So 30 seconds fast walk, 30 seconds a run for 10 sets for a total of 10 minutes. Okay. As soon as you're done that, I recommend going for about a 5-minute walk. Nice light pace, not the fast walk we were doing some basic static stretches, and then you're done for the day. So, we talked a lot about the 20-meter rush and how hand release burpees and push-ups are important. for training that specific exercise with control and just getting used to the overall movement with the burpees. We talked about the sandbag lift with both bodyweight and goblet squats and how those can be important in their own way depending on whether you have equipment or not. We talked about the intermittent loaded shuttle, where we talked about our walk run, which we do at the end, and the loaded carries and why they're important and which ones may be more beneficial for you, depending on if you have the ability to get it to your shoulder or not. And our last one is the drag, very similar to the sandbag lift, where we talked about split squats and Romanian deadlifts and why those movements are important to supporting the squats we did earlier. So give it a go, either 1A, your bodyweight squats, with your 5 hand release burpees, your 10 push-ups, and your 15 squats, or 8 split squats per leg, or 1B, which is 10 goblet squats, 10 Romanian deadlifts, and the 50-meter loaded carry. Alternating through those for a total of 15 minutes, every minute on the minute, so you should be doing 5 of each exercise, 5 sets. After your 2 to 3 minutes rest, do your walk and run prescription, which we talked about already, as the 30-second fast walk and the 30-second run for a total of 10 sets. Okay. Have a little bit of a cool down, and then you're done. Now, for all military members, if at any point during this video you had an injury, please fill out a CF98. For everyone else, make sure to subscribe below to continue getting our content. And I hope you have a great rest of your week and enjoy.
PSP Kingston, the health and wellness provider for the military community.